In this video, I am going to tell you how the parasympathetic system affects the heart and what is its molecular mechanism. Hey everyone, welcome back to HM Learnings. I am Harshita, the creator of HM Learnings, where students come to clear their concept and to get the study material. Make sure that you have subscribed my channel. You can also follow HM Learnings on Facebook, Instagram and Twitter. And now we are going to talk about how the autonomic nervous system. In this video we are going to talk about the parasympathetic system, how it affects the heart and what its molecular mechanism. In part 1 we have already seen about the sympathetic system. So the effect of the parasympathetic system and the most discussed effect of the parasympathetic system is actually the negative chronotropic effect, that is the decrease in the heart rate. So it decreases the heart rate by actually reducing the slope of the phase 4 of the action potential, of slow response type of action potential. So if you haven't watched the video on the slow response action potential, that is the action potential in the pacemaker cells, please go and watch that video. So the effect of the parasympathetic stimulation is that it reduces the slope of the phase 4 of the slow response action potential, and hence the number of the action potentials per minute will be get reduced and the heart rate reduces. Apart from this, it is also having the negative dromotropic effect, which is the decrease in the conduction velocity. So talking about the molecular mechanism, here also what is happening that the acetylcholine, which is a common neurotransmitter of the parasympathetic system, is released, and it is going to affect the conductance by the channels which are responsible for the phase 4. So you can see that in the case of the parasympathetic stimulation, the acetylcholine is released, which is going to bind to the M2 receptors present on the heart. Like here it is being shown that it is going to bind to the M2 receptor, which is coupled to the G protein coupled receptor, and here it is GI, which is an inhibitory subunit, the alpha I, which is the inhibitory subunit of the adenyl cyclase. It is going to inhibit the adenyl cyclase, and there is decrease in the levels of the cyclic AMP, which is going to reduce the activity of the protein kinase A, and as a result the activity of the HCN channel and the calcium channel will be get reduced. So you can see that this effect is totally opposite from that of the effect of the sympathetic stimulation. In the case of the sympathetic stimulation, there is increase in the pacemaker current, there is increase in the calcium current because of the increase in the opening probability of calcium channel and the HCN channel, but here it will be get decreased, so the current through these channels will be reduced, which is going to decrease the slope of the phase 4 of the action potential of the slow response type. And apart from this, the two other subunits of this G protein M2 receptor is actually activating the other type of the channel, which is dependent on the acetylcholine. So whenever the acetylcholine comes, it binds to this receptor, which is actually attached to the G protein, and the beta and the gamma subunit is actually diffusing through the membrane and binding to this receptor, binding to the channel, leading to its opening, and as a result what happens that the potassium starts effluxing out, that is there will be increase in the potassium efflux, and more potassium efflux leads to the hyperpolarization. The resting membrane potential will become more negative, it will be more away from the threshold, and that's why the time taken by the potential to reach the threshold will be increased, the slope will be reduced, and the rate of the heart will be get reduced. So by this we are at the end of this video. If you like this video, please like, share and comment. Please subscribe to the channel, and till then keep learning.